Well, I'm 61 years old. I lived in Maywood for 59 years.
I did my high school years here. I met my high school sweetheart. We got married here.
This is my home.
The village of Maywood was going back and forth in the beginning of the pandemic of being the #1 community as being widespread.
Us in public health knew that this pandemic, like any disaster, always disproportionately impacts the most vulnerable.
So it became clear very early on that Black and brown communities were being particularly hard hit.
People of color that's in these neighborhoods, they cannot get the resources that they need.
COVID is real here. I've been to a lot of walk-through funerals.
Information just didn't get to us, as quickly as it should have.
It was frustrating for me from a trustee standpoint that the residents were calling saying, why doesn't Maywood have a place we can get testing? Why doesn't Maywood have a place we can get testing?
Really immediately, the feeling of the importance of outreach, of understanding the people that were going to be our patients in their context, in the community context, was really important.
CERCL is trying to be there for those that doesn't have access to food, to testing, or to education.
The acronym stands for COVID Equity Response Collaborative Loyola. It's a collaborative, an interprofessional collaborative of nursing, faculty, students, and staff, medicine, law, public health, healthcare administration.
We need to be good citizens in the communities in which we serve and really come together and work together to find solutions that address these problems of inequity and can be sustained and improve health for the long term.
We're not telling them what they need, right? We're hearing what they need, right? And we're sort of responding.
Reaching out into getting testing into those communities, going to where they are so they don't have to travel out of their communities to get this testing. As a future physician, meeting those individual people, helping them is why I want to do this, really build that community relationship.
Loyola brings credibility. People believe in Loyola around here. For them to reach out and be actually here at 9th and Madison, means a lot.
The mission of CERCL is to address the health inequities that our communities of color are facing on a daily basis.
Hi, everyone. Welcome. My name's Jenna Prochaska. I'm a clinical teaching fellow at the Health Justice Project at Loyola University School of Law, which is one of the partners in the COVID Equity Response Collaborative here at Loyola. I'm here today with some of my colleagues, Taya Dragovich and Juliana Perez, to talk a little bit about health and housing and how we work using the medical legal partnership to identify housing legal issues and address them. Next slide. So as I mentioned, we're going to start with a little background on the connections between health and housing and the medical legal partnership model. We'll then focus on some new housing protections here in Cook County and some rental assistance that's available in Illinois right now. And finally, we'll give some information about who to contact for more information and for assistance. Next slide. First, to give you a little more context on who we are, the Health Justice Project is a medical legal partnership between Loyola University School of Law, Legal Aid Chicago, and Erie Family Health Centers. And the Health Justice Project also recently launched a new medical legal partnership in Maywood, Illinois, which is a collaboration between Loyola Medicine and the Stritch School of Medicine. And in each of these projects, students, lawyers, and healthcare providers work together to identify and work to resolve a wide range of health-harming social and legal needs, including issues related to housing and unhealthy housing, which is what we will be focusing on in the presentation today. Next slide. So I just want to give you a little bit of background on the connections between health and housing. So this is a list of some examples of common substandard housing issues that we see and the connections they have to health. So mold and pest infestations can lead to asthma and respiratory problems. Lead, and especially lead exposure in young children, can lead to lasting impacts on the brains and nervous systems of children. Exposed wires and radiators can cause burns, injuries, and fires. High or low temperatures can lead to cardiovascular events, and overcrowding in rental housing can cause the spread of infectious disease. Next slide. There are also a range of significant health effects that are caused by eviction and unstable housing that's important to be aware of as well. Evictions can disrupt lives and cause lingering negative effects on health, including depression, worsening physical health, and high stress levels. Evicted families might be forced to move into unsafe housing situations like emergency shelters or substandard housing with mold, pests, and lead. So again, both of these two areas of connection between health and housing are themselves interrelated. And I want to talk a little bit about how we use the MLP model, next slide, to address these, to identify and then address these connections between health and housing. So first, as background, MLPs are one means of addressing what are called social determinants of health. And so, social determinants of health are the conditions and the environments where people are born, work, live, play, and worship that affect a wide range of health, functioning, and quality of life outcomes. So as we've just talked about, there are a lot of connections between housing and health. So housing is one of the main examples of a social determinant of health. And our medical partners, including through the CERCL project, help us identify housing issues that might be impacting their patients' health, and then make referrals of those patients to us at the Health Justice Project for help in addressing these legal issues and working towards addressing the underlying health issues that impact the patients as well. So we're referred a wide range of housing legal issues. And I want to give a little summary of some of those issues on the next slide. And the issues specifically related to housing. So one area of housing advocacy we take on is related to protecting housing stability, including by defending against illegal evictions and lockouts. And in Illinois, as in all states, before someone can be evicted, the landlord has to go through a formal process that includes sending an eviction notice, going to court, getting an eviction order that must be enforced by a sheriff. So anything that does not follow that process is an illegal lockout. And Taya will get into a little more detail about identifying and addressing illegal lockouts later in the presentation when she talks about the new protections in Cook County. But this is important context for all Illinois tenants. Even before an eviction can be initiated, the tenant must receive a notice terminating their tenancy, and only after they're served with court papers where they could raise legal defenses in court to defend themselves can they be legally evicted. And so after someone receives an eviction notice, could be a really important time to refer them to us or to other legal providers for help raising defenses. We also help enforce the COVID-19 eviction moratoria that are currently in place. Under both the Illinois and the federal moratoria, tenants have to sign a declaration explaining that they are impacted by COVID-19, and so they're protected by the moratorium. The Illinois eviction moratorium requires landlords to affirmatively give tenants that declaration form, so they should receive it. If they don't, for any reason, they can get it on the Illinois Department of Housing website or a website called Rentervention, which also has a tool that allows tenants to complete the forms themselves. And we'll provide that a link to that at the end of the presentation, or you can refer tenants to legal aid to advise them about the application of the moratorium to their situation, and I'll give some referrals to legal aid as well. Another area of housing-related legal advocacy that we take on is related to enforcing tenants' rights to safe and healthy housing. So we'll discuss this in more detail in the context of the new protections in Cook County, but I just want to mention that all tenants in Illinois have protections related to their health and the health of their housing, including an implied warranty of habitability, enhanced protections for tenants in subsidized housing. So those tenants also have other means of enforcing their rights, including by reporting conditions issues to the Department of Housing and Urban Development or their local housing authority. So in particular, tenants who are living in subsidized housing should be referred to legal aid for assistance. There's also protections to be aware of related to discrimination. So if a tenant has been discriminated against on the basis of race, sex, or national origin in housing, again, a referral to legal aid may be appropriate. So on the next slide, I want to get a little bit more into these specific protections in Cook County, but I first wanted to give you that broader context on the wide range of housing legal advocacy that we may get involved with. But the focus of this presentation is on new protections in Cook County. So the Cook County Residential Tenant Landlord Ordinance is a new law that the Health Justice Project worked with other advocates throughout Cook County to help advocate for. And it passed and became law in January of 2021. Most of the provisions actually go into effect today, June 1st, 2021, including uniform requirements for landlords to maintain rental property, procedures for tenants to address substandard housing, and protections against retaliation when tenants enforce their rights. The ordinance also provides protections against illegal lockouts, which were effective immediately as of January 28th, 2021. Next slide. So to give you information about where the Cook County RTLO applies, you can take a look at this map right here. But in general, it applies throughout Suburban Cook County, does not apply in communities that have similar ordinances already in place. That includes Chicago, Evanston, Mount Prospect, and Oak Park. But it applies everywhere else in Suburban Cook County to most rental units with some limited exceptions, including for buildings with 6 or fewer units that are owner occupied. If for some reason your unit falls within an exception, your landlord should notify you that your unit's not covered. Next slide. So we'll be covering today some, but not all, of the new requirements in the Cook County RTLO. So I would strongly recommend reviewing the ordinance or taking a look at the resources we'll give at the end, including from Illinois Legal Aid Online, which provides a nice summary of all of the new protections. But I want to focus today on the protections related to health. So I want to highlight first the new requirements that landlords maintain their properties in good repair. The ordinance requires landlords to maintain rental properties in accordance with building codes. That includes, among other requirements, maintaining floors and walls, maintaining safe exits and windows with locks, providing cold and hot water, preventing bed bugs, preventing standing water, and preventing the buildup of trash. And again, there's a full list of these requirements in the ordinance itself and in the materials we'll share at the end of the slides. Next slide. The ordinance also sets out procedures for requesting repairs. A renter must notify the landlord of needed repairs in writing to be covered, and the landlord has 14 days after receiving a notice to address non-emergency repairs. If the landlord does not make the requested repairs, the tenant has the following options. They can make the repair and deduct the cost from the rent if it's less than $500 or half the rent, whichever is larger. It's important to know they need receipts and to provide those receipts of the repairs. They could also withhold part of the rent, and they would need to do that by estimating what would be a fair deduction considering their repair, and again, no more than half of the monthly rent. Or they could decide to leave the unit and terminate their lease. So there are also a whole separate set of requirements under the ordinance for requesting emergency repairs. And it's important to note, next slide, it's important to note that for all of these options, consulting with a legal aid attorney or a lawyer before withholding rent is really important, because there's a lot of specific requirements set out in the ordinance that have to be closely followed. Most importantly, providing written notice to the landlord before a tenant can safely withhold rent to get repairs made. It's also important to know that the amount of rent withheld needs to accurately reflect the cost of the issue, and courts almost never decide that a renter is entitled to withhold a full month of rent. So consulting with someone before withholding rent and before deciding how much rent to withhold can be really helpful. It's also important to know that subsidized tenants, including Section 8 voucher holders, likely should not withhold rent because, as I mentioned before, they have other options of addressing substandard housing, including by involving a housing authority, which would likely be a safer option for them, and withholding rent could put their housing assistance at risk. And again, we'll provide referrals at the end to legal assistance and legal self-help for folks who are wanting to consult about their specific circumstances. Next slide. So finally, it's important to know that landlord retaliation is prohibited by the ordinance. This means that renters have a right to complain or speak publicly about their tenancy or assert any right they have in the ordinance without fearing retaliatory reactions from their landlord. So for example, they can speak to the building or the health department, the police, media, community organizations, tenant unions, or the landlord themselves about their complaints. And the landlord should not or cannot legally retaliate, meaning pursue an eviction, increase rent, reduce services, or refuse to renew a tenant's lease as a result. The landlord might be able to show that these actions that they took were not retaliatory, that they were for a legitimate non-retaliatory reason. For example, that the tenant or a guest or a family member caused a material lease violation, and that's why they were engaging in these actions. But retaliation is prohibited, which is really important because it should give tenants some comfort to know that they can enforce their rights under the ordinance without fearing that they would be putting their housing at risk as a result. And I'm going to pass it over to Taya now to talk more about the lockout protections and some rental assistance in Illinois. Thank you.
Thank you, Jenna, for passing it to me. So one thing that Jenna mentioned is protected under the ordinance is against legal lockouts. So lockouts have always been illegal in the state of Illinois without the proper procedures, and that includes going to court, getting an eviction order, and then that's then enforced by the sheriff. So not going through the full procedures has always been illegal in Cook County in Illinois. However, this new ordinance gives an added layer of protection against those illegal lockouts. And a lockout really covers a wide range of landlord actions. Here you can see a list of different things that might be considered a lockout. For example, changing, removing, or adding locks, removing or blocking doors or windows, and removing a tenant's personal property. Those would all count as a lockout, as well as removing any necessary fixtures or appliances, and then also interfering with any of the services or utilities such as gas, heat, hot or cold water, plumbing, and telephone service or internet. So all these bullet points would constitute a lockout, and even threatening any of these actions would also count as a lockout. Next slide. So if a tenant is facing an illegal lockout, there are steps that the tenant can take. So first, it's important to know that this is an illegal action on part of a landlord, and therefore a tenant is able to call the police or 911 under this circumstance. Once the tenant would call the police, some advice would be to present a proof of tenancy to the police officer, something like a lease, a rental payment, or utility bill. And if the lockout is in the form of a utility shutoff, then having a statement from the utility company that shows that the tenant's account is in good standing would also be good practice. So calling the police is one option. However, tenants might not want to call the police for various reasons. And some alternatives to that would be to call the local building department or township to report the lockout, and then also working alongside housing advocates to either negotiate directly with the landlord or to pursue some sort of legal action against a legal lockout. Next slide. I also wanted to talk a little bit more about a new rental assistance program that's currently out in the state of Illinois. So applications are open on May 17th, And the first portion of the application, which is to be completed by the landlord, will be open until June 7th. And it is a dual application between a housing provider and the tenant. So the first part is open until June 7th, and then the second part, which is the tenant part, is open until June 14th. So applicants that are eligible for this assistance, they might be eligible for up to 15 months of assistance. That can cover past 12 months of rent, as well as 3 months forward if that's needed. And the total maximum grant amount is $25,000. There are a few eligibility requirements for this rental assistance. So tenants must be behind on rent for at least 30 days. They must live in Illinois and rent their home. And they also must have experienced a financial hardship indirectly or directly due to the pandemic, such as losing their job, losing hours at their job, having to stay at home to take care of someone who was sick or to take care of their children, would all be examples. Also, there should be a risk of homelessness or housing instability, and there is an income cutoff that's set at lower than 80% of the total gross income of the median income for that location. And tenants can go online, and there's a chart of all the income cutoffs by area. And it's important to note that this aid, a tenant's immigration status, does not affect their eligibility, so no social security number is needed, and that's not a criteria for this grant. Next slide. So a little bit more about applying. So the application is completely online, and both landlords and tenants would go to this link to access the online portal. Again, it is a joint application where the first part of the application is to be completed by the landlord, and then the second part is to be completed by the tenant. Once the landlord or housing provider completes their portion of the application, the tenant would then receive an email to complete their part, and an application will not be complete and go under review until both parts are created. Next slide. So here are a little bit of the details about the application. So again, first, the housing provider would go on the online portal and complete the initial application, which just asks for some information about the unit and the tenants. And then after that's completed, within 24 hours, the landlord will receive another email to complete section 2 of the application. So that includes inputting additional information, as well as uploading required documents such as evidence of past due rent, the signed leasing agreement if it's available, and a couple of other documents listed here. And once the landlord completes section 1 and 2, then the tenant would get an email. Both the landlord and the tenant must have active emails for this application, and the tenant would get an email to complete their portion of the application, where they would input their own information as well as the documents that are asked for, such as a government-issued ID, a utility bill or proof of residence if the address isn't the same as the ID, proof of rent due, proof of income, as well as any proof of any public assistance the tenant is receiving. And again, no immigration status is needed, so no social security number will have to be uploaded, or no proof of immigration status is needed for this application. Next slide. So this is some helpful information for those who would be interested in applying for this assistance. So the first link is where you can get more information, and it has a large list of different FAQs that go into detail about the documents needed, about how to go through the online portal, and what's needed from both the housing provider and the tenant. To apply, the second link is where the actual online portal is located, and if a tenant or landlord needs phone call assistance for filling out the application, they can call this call center. And once the application is completed and under review, tenants and landlords can go to the status page to check whether their application is under review and what the status of their application is. Again, the landlord portion of this application is now open. It will be open until June 7th, and then the tenant portion will be open until June 14th. So that's all the information about this rental assistance program, and I think now I'm passing it back to Jenna.
Thanks, Taya. That's really helpful. And as Taya mentioned, the resources she put on that last slide are where you should go, both for the application and for more information about how to apply. There's really useful FAQ. So if you have questions about, how it applies to you or how you can get your application in for this rental assistance. Again, deadline's coming up for landlords on June 7th and for tenants on June 14th. So it's important to get those applications in soon if you're interested in that assistance. Again, we wanted to provide you with some referrals and some information about where you can go to get more information generally on your rights as a tenant in Cook County. So if you're looking for advice or self-help resources, these are some really useful resources for you. Rentervention.com, as I mentioned, has some online forms to complete a declaration form or other walk you through common renter rights issues. The Metropolitan Tenants Organization runs a hotline where you can talk with a housing counselor and get advice or referrals. And Illinois Legal Aid Online has really useful self-help resources, including a Form 14-day letter demanding repairs. So you can go on there and get some help or forms that you can use. Next slide. If you're looking for legal assistance, these are some referrals you can use. The CARPL's hotline, the Coordinated Advice and Referral Program, operates a free telephone hotline where you can talk directly with attorneys and get really useful referrals to other service agencies. Catholic Charities, Legal Aid Chicago, the Moran Center for Youth Advocacy, and North Suburban Legal Aid all provide legal assistance, so you can contact them. And again, Illinois Legal Aid Online has a form you can fill out to request legal help and get connected with the best legal services provider, given the situation that you're facing. So hopefully those resources are useful to you, and it's been nice having this opportunity to talk with you all about your rights as renters in Cook County. Thanks.